And now to the latest on the coronavirus. Local health experts say an uptick in COVID-19 cases is likely due to recent large gatherings. WREG's Alex Coleman talked with one infectious disease specialist about his concerns, especially as more people will be getting together and traveling during the summer.
I just think that we need to just be doing everything that we can to protect ourselves and our loved ones.
After a Mother's Day weekend filled with gatherings and music fans coming into Memphis for the Beale Street Music Fest a week earlier, along with other factors, Shelby County is experiencing an increase in COVID cases. Desiree Dyson says her family is ready to mask up again if it means staying safe.
It's getting worse, and whatever we can do to flatten the curve, we're going to do. If that means putting on a mask again and being uncomfortable and being barely able to breathe again, then that's totally fine.
The health department says Shelby County's 7-day average for COVID-19 cases is hovering in the triple digits again. As of Monday, there were 132 cases. Dr. Steve Threlkeld, an infectious disease specialist at Baptist Hospital, is not surprised.
Let's face it, the community, the country is tired. Nobody's really wearing a mask anymore. Outdoor activities are safer than indoors. All of those sorts of things that we became more used to worrying about early on, they're still the case. It's just that we're not as worried about it anymore. And
health experts say people who are not fully boosted or have immune deficits are still at risk.
I think as big a problem in terms of the serious disease would be people who are pregnant, people who have other kinds of immune suppressing problems, and then the older end of the population like we saw in the beginning.
Dr. Threlkeld says one positive sign is we haven't seen more people in the hospital because of COVID.
Well, thankfully, we haven't seen a huge uptick in hospitalizations. We always have been, and we remain at this point, unfortunately, kind of at the mercy of what variants come at us and what the virus throws at us.
And as we head into the summer, the advice remains the same. Protect yourself by getting vaccinated.
The first and foremost issue is to try to be protected to the extent you can be protected. And by and large, that is to get vaccinated, to get that booster, particularly if you're over 60 years of age or if you have any sort of underlying immune problem.
Alex Coleman, WREG TV, News Channel 3.
Some advice to keep those numbers low. And the spike in cases mirrors data from the CDC, which also indicates the number of new cases is going up in many parts of the country.